All right. So we'll continue the thread, in terms of the sessions here. I hope you're onto the rhythm, which is, starting with CMS and ONC and payer to payer, moving into the patient access rule, some experiences from the market and some payer customers, and then Pat and Kyle having just talked us through testing of apps and testing of connections and what tools are out there for you. And now we're going to pivot over and talk about the app side of this rule and really all the opportunities that this creates. So we're lucky to be joined by Aneesh Chopra, Tori Buck, and Jennifer Blumenthal. I'll introduce them quickly, and then I'll hand it over to Aneesh to drive part of the conversation. So Aneesh is the president of CareJourney. It's an open data membership service building a trusted, transparent rating system for physicians, networks, facilities, and markets on the move to value. He did serve as the first US CTO, and he authored Innovative State: How New Technologies Can Transform Government. And Aneesh is joined by Tori Buck, who's Senior Product Manager at Health Data Analytics Institute. It's a Boston-based predictive analytics company focused on pop health and patient health. Tori focuses on predictive analytics for population and patient health, and brings her passion for user engagement to Health Picture, which is an exciting app. It's HDAI's direct-to-consumer health app. And then Jennifer Blumenthal, also with us here on the panel, who's an expert and advocate for data access in the consumer healthcare space. Jennifer is the chair of the Privacy and Security Committee at the Commonwealth Health Alliance, chair of consumer-facing technology at Care Equality, and co-founder of OneRecord, a really important app in the space here. So thank you guys for joining us. And Aneesh, I will hand it your way to help us navigate the conversation today.
Yeah, Nolan, thank you so much. And real excitement to have this session on the eve of 7/1. I just caught the tail end of this, but I assume that's the recurring theme. We're all excited about the go live. What I thought I might do is just maybe set the stage for a couple of items. I don't know if I can quickly share. I've got just a few slides, if that would be possible to share. You can just give me a thumbs up if you all can see that, if it's coming through.
You're good.
Thank you so much. Obviously, to me, the broader set of rules, it's one thing to talk about the compliance side. How will you deliver? How will you deliver? What will you push forward? I think the message we want to come out with is frankly it's the inverse of that. It's what can we do to help people live better lives? And what are the types of applications that we're going to see coming to market? And obviously, patient applications will be front and center, and we're all eagerly awaiting what will be some of the most high profile and potentially the most widely deployed apps that have been captured by the patients. By the way, forgive the lawnmower on the outside. We're having a fun grass cutting outside. So you'll enjoy that hum in the background. This is my opinion, and I'll set the stage in the following way. There are 5 initiatives where I'm going to be putting a lot of my personal energy to make sure that these applications really operate in the best interests of the American people. And the Biden administration's made it clear that as we come back from the pandemic and we sort of get the economy moving again, there are going to be a number of initiatives that will take front and center. I believe 5 of them will kind of link off of the work we're all doing for not only for 7/1, but more broadly across electronic health record interoperability, as well as the payer side. Number 1, and I think central to this, right now, the governance model for patient-facing applications is mostly of the variety that don't lie to your customer and then you can operate. The Federal Trade Commission today regulates commercial applications if they deceive their customers. Short of that, it's a bit of a Wild West. I'm hoping we're going to get more industry consensus to go beyond what's minimum in terms of protecting the American people, and to aspire to a broader vision of what I refer to as a health information fiduciary. Now, the attributes of a health information fiduciary are that they access information on your behalf, run decision support that's in your best interests, and then I hope they compete on making it easier for you to accomplish the things that are going to help you live a better life. There's a mechanism I believe the administration will sort of oversee that will bring more health information fiduciaries to life, and that is the Medicare Direct Contracting Program, which also went live this year in April with a new feature where patients could digitally affirm that this primary care network that might have a mobile app associated, it doesn't require it, but if it does, will be my main point of contact for what will be my fiduciary for managing my care in the Medicare program. I'm excited about this opportunity, and I'm eager to get as many patient-facing applications to raise their hand and say, I wish to be a fiduciary, to go above and beyond, and I'd like to connect to those physician networks where I can be part of the care team to make sure folks get the best possible care. That's the dream. Payers and providers are going to reuse the patient access API, in my opinion, to facilitate more efficiency. I am of the view that it may be the 20/80 rule, that the value of the patient access API may actually be in lowering administrative frictions, maybe above and beyond the number of unique patient downloads for specific apps. And you'll see that because one of the interesting parts of the rule, of course, is that payers have to take whatever clinical data they have and convert that to FHIR in order to meet this deadline. My view, and I think it was sort of implicit in the rule, is that payers are going to be asking providers to access their FHIR resources natively. And that it may be that the payer itself might be the consumer of the provider's FHIR resource, and that from that may facilitate more burden reduction, annoyances like prior authorization or denials or any number of other ills that we see in the system today might fall short if we can facilitate the data sharing. I personally think applications that can help patients route to doctors that are right for them will be a really important use case, and the data sharing might make it easier for us to find doctors that are right for you. So don't search just on generic Yelp ratings about who's a nice to patient doctor, but rather who treats patients like me, and how might we figure that out. In fact, the Affordable Care Act spoke about the release of Medicare data to create those sorts of patients like me performance reporting, and very eager to get that policy initiative underway. But obviously, health equity is the top priority, and we've heard a lot about this in the Biden administration. My sense is that we will see more focus around patient access, I hope, tied to closing the health inequities. And so already on day one for the Biden administration, there's been a call to action to look at every program administered by the government by race, ethnicity, veteran status, disability status, low income status, and the like. And we need a new round of patient privacy controls. I obviously co-chair the Karen Alliance. I'm very proud of the work we've done on the Code of Conduct, and I'm grateful for OneUp to helping facilitate the back end of the apps that have attested, like OneUp has, to the Code of Conduct. We need more participants, and we need to put more teeth on the enforcement mechanism side. So just to be respectful of time, I thought I would go deep on the health equity discussion, because that is the one area where we have the most dire need for patient-facing apps to make a difference. If you're a Medicare beneficiary and you live in the most economically distressed neighborhood relative to the Medicare beneficiaries that live in the wealthiest neighborhood, what you find is a very sobering set of statistics that we know intuitively, but feels more frustrating when you see it on paper. You are half as likely to get the flu shot, half as likely to get an annual wellness visit, half as likely to get a care transition visit, or a third less, on and on and on. And unfortunately, you're more likely to use the emergency room for reasons that aren't necessary. So as we think about the challenges of our society, I hope the applications that come to life on 7/1 and beyond really do speak to empowering individuals with the information they need to make smarter choices. I'll leave you with this one anecdote just to kind of wrap up my opening remarks. Early, or I should say late in my tenure in the Obama administration, I had the pleasure of launching this $1 billion innovation challenge. And it was part of what was called the Healthcare Innovation Awards, something program funded by the Medicare Medicaid Innovation Center. And the idea was, if anyone in the public had an idea that would lower costs and improve outcomes, we would reward essentially a clinical trial, maybe we'll call it a payment trial, to test whether individuals who received that service got better care. And if they did, and the independent actuary of CMS validated the math, we could scale that to every beneficiary. Well, here's the vignette. The first graduate of that innovation challenge was none other than the YMCA Diabetes Prevention Program. The actuary certified a 4-to-1 return on investment. If you're pre-diabetic and you enroll in this program and you get the coaching services of the Y and you show up for these clinic, evaluations, coaching sessions, you lose weight, you don't get full-born diabetes, and you save Medicare on average $2,400 a year. On the $600 voucher to enroll in the program, that was seen as a pretty good ROI. On that evidence, in 2018, Medicare made a nationwide policy change. Any doctor in America could prescribe the diabetes prevention program. Now, CareJourney, my company, happens to have a research license, so I get quarterly updates on all the Medicare claims. At the end of 2020, a year and a half later, and we of course had the pandemic, which has a challenge, but aside from the pandemic, we never crossed more than 1,000 patients in a given year signing up for a service that we know is better for them. How could we, as a society, know that there's an intervention for pre-diabetic patients that's right for them and fail to route them to the local Y to get the service? My challenge to my patient app developer friends that are going to be on this panel, and maybe those that will follow, is that we close those gaps. If you are accessing the patient's health information and you see that they qualify for a program like the diabetes prevention program, encourage them to enroll. Do what you can to help close that gap, so more people that are eligible for a service take advantage of it, rather than have it be something that just sits on the shelf and we fail as a society to reap the benefits. Please join the movement and become a health information fiduciary. I thank you for the time. I wish you well, and I can't wait to hear what the panel has to say.
Thank you, Aneesh. That was an inspiring rally cry. So certainly, really important and backed by really impressive data. So thank you for that. I think, Tori, if you want to pick up and go next.
Yeah, definitely. At first, I definitely want to thank the OneUp Health team for inviting us to present some of the work that we've been, actively trying to put forth into the world, right? But also, give you the opportunity to kind of see a little bit more about what HDAI overall means and what we've been working on as well. So first, at the heart of it, HDAI, or Health Data Analytics Institute, is an analytics and modeling company. But beyond that, we are incredibly passionate about healthcare data and how we can, also allow patients access to that data. And beyond that, how can we add value to that information and make it actionable? So with regards to what we try to provide within the industry itself, is really around how we can help with the management of health. So we work with many different consumers of health data. We try to provide intelligence using our predictions for spotlighting areas of focus, such as potential hospitalizations due to adverse events, or even onset chronic conditions because of other health concerns that might be happening. Those consumers that we are currently servicing are the individuals, and we'll talk a little bit more about that with the health picture side of it. But we also help with the providers and researchers. So from a provider perspective, how do we help them improve patient care overall? And then from a research perspective, how do we help them find other areas of places that we could assist and perform some of that research and provide results. And then at the population health level, how do we take all of that information that we're learning at the patient health, the patient level, and roll it up to improve patient outcomes overall, to further population health as a whole? So from the health picture perspective, on the individual consumer level, what we were looking to try and do, obviously last year was a huge time of, uncertainty and concerns over health and how people who may be dependent on going to see the doctor on a regular basis, not being able to do so. And then beyond that, if you think about it from a perspective of a caregiver now suddenly not able to access or see their loved ones and provide any sort of care that they might have been doing. What could we do as a company to help improve that while everybody was working rigidly trying to get everything going in terms of pandemic time? So what we did is we created this app in about 3 months called Health Picture. And we focused first on presenting Medicare members with a way to see the information that was available from them for the CMS Blue Button 2.0 downloads. And then furthering that, trying to add additional value to that, but providing that data against our predictions and providing insights so that they can see that information, maybe take some action from there. And now, of course, with the patient access APIs coming forth, how can we take advantage of that and provide the same level of value that we were providing to those Medicare folks to individuals that are taking advantage of Medicare Advantage programs for anybody that's doing Medicaid or Medicare eligible individuals. So our first use case was really around how do we connect users. With regards to going back to how those individual patients were not able to access the level of care that they might have been used to. If you think about it from a perspective of, you're somebody that maybe lives in a different state and you have your parents are living someplace else and you can't go see them. You can't just jump on a plane and go and see them and provide any sort of care, especially if something's happening. If they're having health issues, it becomes much more of a concern. So looking at ways of how can we connect these individuals through allowing them the ability to create accounts within Health Picture and then securely link them, and then empowering those folks with their data to be able to share it the way they want to. So empowering them to be able to share that information to their caregivers or be able to share it with their providers if it's needed, and then at the same token being able to revoke that sharing. So making that more seamless. One of the use cases that kind of came in from one of our champion users had to do with, she was trying to help her father go to the dentist. And she didn't know, looking at the medications list, whether or not he was on a blood thinner, right? So just seeing the value of what we were providing, and then how else we can add information and value to the data that we have. So one of the things that we ended up doing is partnering with another company that is able to provide the information, such as what sort of brand names are associated to some of these drugs, as well as what sort of categories there are, and make better informed decisions and be able to help with the care by talking with the dentist and saying, yes, indeed, he's on a blood thinner, and that makes it much more useful for them overall. So beyond the medications thing, but giving them a curated list of all of their historical information with regards to who they've seen, what providers they've been talking with, what visit information they've been kind of having going through, and then with regards to any sort of new conditions that might be reported on their medical record. So overall, just really looking for ways to provide better avenues for conversations with their loved ones, and better conversations as well at those doctor visits. So one of the things, the biggest use case is obviously like people get access to their information, they have it all in one place. There's a lot of apps out there doing that, and I think that's great. One of the avenues that we were trying to go forward with is how do we additionally add that value with regards to our predictors? How can we help people? And to see that information up front, maybe be proactive about it, And then on the flip side of it, also allowing them an opportunity to not see that information. So it's an interesting stat. I think about 50% of our users opt in to see these insights. So it's, a challenge for us to try and make sure that we're presenting this information in a meaningful way, but also not scaring them. It's really difficult to tell somebody that you are at high risk for a heart failure or a stroke. And how do you make sure that you're having that conversation with them effectively in a way that, isn't frightening them, but also making it available so that those caregivers also are aware of this and they can make sure that the conversations are happening to effectively take care of them. And then in terms of seeing the whole picture, this actually leads more into what we're looking at for a road ahead. Obviously, with the patient access APIs coming into play and getting access to that payer data, we are working to try and get connected. But I think overall, it's really important for us to kind of go in line with what Aneesh had said. How do we partner with data aggregators to make sure that we're presenting an entire picture of somebody's health record going forward? And the reason why that's really important for us is if you think about it in terms of predictions, yes, we're relying on claims data right now and being able to take that data, present it to our models, and then come back with it to give them that information on the predictions. But if you think about it and you're connecting to multiple payers, you're really only getting a part of that history, especially if they have multiples. So one of another champion user that we have was connected to Medicare, saw that the information, was really excited about it, but then said, well, I connected to a Medicare Advantage plan. Now what do I do, right? So we were able to get connected. This happened to be a Humana user in the end, but now how do we present that in a way and not take on the ownership of aggregating that information specifically? And then in terms of that full health picture, the other part of this is we present tests because it's claims data. We have all of the lists of the tests that we have available to us, but we don't have a list of all of the results. And that actually ends up being one of the dominant questions that we get within our support email box is, hey, I need my test results. And it's not something we have available to us just based on the data. So how can we then link that information up and provide them that information together within the application itself and make it more actionable? So kind of back again to that diabetes thing, if we're predicting that somebody's at high risk for diabetes, how do we then present them with the same type of information that's actionable, maybe put them into that diabetes or recommend that they join that diabetes program? And then finally, with more insights, we're constantly building on our predictors and our model libraries. How do we then continually keep the flow of that information going and make sure it's helpful and presented to our users in a valuable way? So finally, I just want to give everybody an opportunity to kind of see where we're at. You can go to healthpicture.com and see the app, sign up, it's free. You can connect your information if you have it available to you. And then from there, if you want to find out more about HDAI, you can go to our corporate website. So thank you, Nolan.
Yeah, thank you, Tori. Really appreciate that. And there's definitely some great questions piling up, but we'll go through Jennifer and then get back together as a panel and go through some of the Q&A. So thank you for that.
Hello, can you see my screen?
We can, yes.
Okay, hi everybody. I'm Jennifer Blumenthal. I'm the CEO and co-founder of OneRecord. OneRecord is a consumer-facing application that enables the user to access and aggregate their healthcare information from across the ecosystem. When we started, we were really focused on medical records. I had a friend who got really sick and carried around a binder, and we naively were like, oh, well, we could just build a better Microsoft Health Vault. And that's kind of how we started working on OneRecord. To now, we kind of expanded it to not just trying to get all your medical records in one place, but actually getting all your healthcare data in one place. We're a Karen compliant third-party application, which just means we attested to the Karen Code of Conduct. We're very actively involved there. And we also are one of the only apps to get certified with the UDAP profile via ENAC. And so I'm just going to kind of run you through some high level points about OneRecord and then kind of where I see the app ecosystem going in terms of claims data and what the opportunity I think is, or what people might be thinking about. So like I said, OneRecord is a third-party application. We have a iOS app, Android app, and a web app. So people can literally access their data from across any device. They can switch devices. It doesn't matter where they onboard. This is a sampling of our current EHR hospitals and connections. I just took some high-level logos and put them here, but essentially OneRecord's connected to the top 10 vendors who do have a FHIR API out right now. That's mostly a DSTU2 version. We're watching as people are migrating to R4. We're one of the 5 apps that are enabled by the VA, so we're able to help veterans get access to their data both inside and outside of the VA health system. Something we've been working on over the past year was the ability to allow users to share their data with loved ones or people that they need to share that information with. So we have created the ability for not only users to share their information, but also to create multiple accounts. So if you have a dependent or somebody else that you're caring for, and then we started moving into notifications so that we can notify people when new data became available. The thing that my team is most excited about right now is the payer APIs. So being able to access not just the clinical data, the financial data, but the formulary data, but being able to make that useful for users. So getting medical records was always very exciting. We, when somebody wanted those lab results and they came in, or they were looking to essentially create that one view, that one longitudinal record, that was fun. But now what's even more fun is being able to start working with the data that's coming out from the payers. Most of our work to date has been through the connectathons. And then, people who have been standing up their FHIR APIs pretty early. I thought I'd do another logo garden for you, which on the left, you'll see third-party vendors who are standing up those FHIR servers that we connect to or tested against, and their clients that will be able to connect to through them to their FHIR APIs, and then people who've also stood up their own FHIR APIs and connect to them. This is not everyone in the ecosystem. These were just the ones that I pulled out that I felt comfortable showing at this meeting. So that's a high level of OneRecord. We really are focused on user experience and making the data useful to consumers. Something that we've seen is, users are used to getting data from their providers, the payers, different stakeholders, but this is really the first time that users are getting data through third-party applications. So there's a little bit of sometimes data quality problems, or maybe data doesn't look the same way as in their member patient portal as it does in OneRecord, just based off how we get the FHIR resources. And I wanted to highlight this because that's something that we as app developers have to work on. And, hopefully when people not just have read APIs, but also write APIs, we can correct the inaccuracies within the data instead of the member or patient having to go to, their health plan or provider to tell them their data isn't correct. I thought it would be important to say, I think today people, when they think of third-party applications, they're thinking about apps that are going to live within a app marketplace or an app store like on iOS or Android, but I don't think that's necessarily the case. I think you're going to see all types of apps pop up. I think you're going to see organizations that are going to want to leverage the APIs for maybe a consumer flow within their normal business use cases. And I think that payers probably need to prepare themselves for that not all apps will look the same. They might not all have the same education level as an organization like OneRecord within the space. And that's probably something you should have on your radar as you're thinking about this. To me, this is really the opportunity as payers are working on to comply with these requirements, for patient access, provider directory, peer-to-payer, and then so on. I think that this is really going to be the differentiator for organizations as they think about, okay, compliance checkmark done. What's next? What are we going to do? What are we going to get excited about within their organizations? For me personally, the price transparency rules is really what I'm looking forward to. Everything that I imagine to be consumer facing and forward thinking and resembling, the things that I consume outside of healthcare. I think that the price transparency rules are going to usher in that era. So I think that this is probably the place that people should be thinking about. What do they want their member experiences to be looking like when consumers not only have their data from both their providers and their payers, but also they're going to have more insights into the cost of care. And I'm going to stop there and let people ask questions.
Great, thank you, Jennifer. This is like really cool. This feels like we've hit the crest of the meeting today, because we started off with all the regulatory changes and what's happening in the industry, and then all the work that the health plans and their vendors had to do to get to this moment in time, and then boom, Tori and Jennifer show up with products that are consumer facing and consumer friendly and bright and engaging, which is, you know, really, really, really important for all of this great work that's being done. So thank you guys for sharing that. One question, which is a big one, because it's more than like your products and it's about like human behavior, which is, how can healthcare apps start to become more and more of a go-to resource in a consumer's life? And I don't know who wants to try to tackle that one first, but
I'll go. So so there's two things. So I think the first thing from a compliance perspective for payers to think about, payer-to-payer API, where is that request going to be initiated? It's going to be initiated. I heard somebody say this earlier in the conference. Are you going to reuse those patient access APIs, or are you going to use new APIs? If the patient request is going to happen within the third-party application, that's going to be like probably the first thing that you're going to see happening. I think that we're already seeing consumers use OneRecord to move their data for things that are totally unaffiliated to healthcare, just whatever their use cases are. The last thing is, I personally think people are going to build the Expedia of healthcare coming up with the price transparency rules. I think you're going to see, like, I imagine a point where retail clinics are going to essentially say, oh, you've had this lab test, maybe you should buy this item, go to this store. Maybe it's within their own store. Maybe Target does it, maybe Walmart does it, maybe Amazon does it. I think a bunch of the appointment booking applications are really going to leverage these APIs to do, you know, personalized care journeys based off of your claims data and the negotiated rates. And I think you're going to see a lot of hybrid use cases. So I do not think that stakeholders should underestimate consumer demand as it becomes available and ubiquitous.
Yeah, and just from a little bit different perspective, I totally agree that we probably only scratch the surface of what's available or what's possible with having people have access to their data. But if you think about, there's already a lot of apps in the healthcare space. We may just not call them that. And things that come to mind are like Fitbit or Noom, and it's stickiness, right? It's something that's actionable. It's stuff that they can track and check in on a regular basis. And how do we do that with an app like even Health Picture? How do we do that with other apps that are you know, trying to basically be the app that people are going to on a daily basis because there's something there that they can do? And that's where I kind of was going with the actionability piece. What can we use from the data that's available and make it something that is, you know, sticky, something that they want to go in and say, oh, I need to do this now. And they go off and they do it and check a box and, you know, gamify it to some extent so that they understand, you know, what it is, what their next step might be.
Yeah, nice. That definitely makes sense. We talked, you just talked about, Jennifer, you spoke about the price transparency piece. So maybe that one aside, what are some of the other innovative uses of this combined clinical and claims data that you foresee either your own apps or other apps implementing? Is there like can you help us dream a little bit?
Yeah, so I'm going to exclude price transparency in what I'm about to describe. I think that I think it's going to be a lot of transaction-based events. So right now, like Tori just touched upon more of behavior pattern apps. I really think a lot about OneRecord and apps that look like OneRecord to be similar to when people ask us what it's like. I'm like, well, it's like Venmo. You're able to connect to multiple bank accounts and move your data across places to the people who you want to move it to. So I think about it like that. is it's going to be very transaction based. It's probably going to mirror both the financial space and the e-commerce space. So you're going to use your data for specific kinds of transactions, and you're also going to use your data to create personalized healthcare experiences. And I think a lot of the personalized healthcare experiences are going to be driven by purchasing decisions. So should I buy, I got this hemoglobin test back in, oh, maybe I need this item and my retailer is pushing it to me. I really think a lot of the experiences will be around that early on. And I think the thing for health plans to think about is a lot of it will be new member enrollment, not having those insights into those new members as they come onto a plan. And this time they can onboard with all their historical data. And I think you can use that for telemedicine, all kinds of things. Just think about that intake experience. An analogy would probably be like you book a flight on delta.com, but then you have your Delta companion app to board the plane.
Mm-hmm. Interesting. Anything to add, Tori, or that covered it?
No, and nothing really to add to that. I think it's a very interesting perspective, and I do agree that I like the similarity that Jennifer drew, like the Expedia app, in basically being able to utilize these apps to look for that next step.
Yeah, we have on the line with us today, I guess in the video with us today, the conference today, a lot of other app organizations. What advice would you give to them, or what do they need to be doing to go live with this type of data? I don't know if it's like a cultural answer or an infrastructure answer, or maybe all of the above.
Yeah, I would say the three things we've learned over this past, all of 2020 into 21 is it's still very early. This is day one. Like literally April 5th was only a couple of months ago. July 1st hasn't even happened. So it's very early, and you need to build your apps as really MVPs right now. You're not going to get all the data you want. There's going to be a lot of missing data. The data is going to be really dirty. So you need to be very strategic, because really apps only have a certain amount of time and resources to get to market for whatever it is. So you're going to either want to be very focused on a certain market, a certain place, something specific, and then you're going to want to figure out what is your data acquisition strategy around that. So for us, something we've learned, just because FHIR is the standard does not mean FHIR is being used the same way it was laid out in the rules or implementation guides or wherever you read about it. Everyone has a little bit of a different interpretation. And so there's a lot of different flavors of, things just around the OAuth workflows and just subtle nuances. And you're going to have to learn that. And another thing is just the onboarding flow, like the process for each organization is going to be different. It's going to be time consuming.
Oh, I think we lost you, Jennifer. Yeah, we did. Okay. Do you want to pick up with anything, Tori, or should I go to another question for you?
No, I think that's actually, that really hits at the heart of part of the problems or the challenges that we've had. You can imagine we started off with the CMS Blue Button data, which is very rich data set. It's got a lot of data elements in it. And when you start from that level of expecting all of those elements to be in existence in the data that you're going to be getting from every single payer, you're going to be disappointed. So we've definitely found, some areas where we need to kind of reevaluate what we were utilizing specifically for the app to curate some of that data. And I think it's important for people to realize that. And she's totally right. Jennifer mentioned the data is going to be really rough, and it's not going to be entirely clean when you get it. And you're just going to have to figure out what to do with it.
Yeah. Early in our presentations today, we spoke with 3 health plans and their experiences of getting their organizations ready for this type of activity. And they all talked about privacy and security and getting their organization to have to think differently about privacy and security. And I'm curious, that now puts not more burden, but shifts some of the onus to organizations like yourself. How do you guys think about the steps you take or the systems you put in place to either prove your privacy and security to your users, or perhaps even to other organizations?
Yeah, so a lot of it started around communication. Like, how do we communicate this effectively with the users that are going to be signing up? We don't actually collect the data. Like the important part here isn't the data for us. The important part here is being able to provide value to the people that are seeing the information. So being able to see maybe the predictions that we're able to provide that help them to make better determinants of what they're going to do next to improve care. From that, it's like, how do you make sure, you're right, in the privacy policy, like, how do we make sure that they're not going through that and going, oh, what are you going to do here? It's really about transparency. I feel like you need to be upfront and clear with the people that are going to be using your app, and help them to understand the security measures that you've put in place to make sure their stuff is safe. And then also being clear about what happens, if they don't want to share their data anymore. And for our sake, it's really, we delete the information, it's gone. We don't have the availability to it anymore. And it's the only reason it's stored there is because they agreed to connect and that they wanted to see their information in the app. And that was really it.
Got it. She's back.
Yes.
Hey, Jennifer. Let's see. Jennifer, you had talked a lot, not a lot, but you definitely highlighted the value and your excitement around the financial information. I'm curious, for both of you in your organizations, maybe if you could just comment, like, what's the culture within your companies right now? Do people feel as though you're at this moment? Do you feel even like a burden to prove something, to break a new wall, whatever it might be? How does it feel to be on your side of what's happening?
I mean, I'm excited. I think I'm excited about the financial stuff because I have to say, I think when we look back in this moment of time, the payers will be the winners, just because they've been just a little bit more forthcoming and easy and like, okay, here, take it and go build something amazing with it, as opposed to the provider EHR side, which is still very concerned about a lot of things. My team is really excited because we've been trying so hard to build something that was easy to use, like very clear on what the job to be done is when a user enters into the app. And so that's fun for us to keep iterating on the design. We have a really high conversion rate right now. People who come to OneRecord convert at about 30%. Most websites convert at like 2 to 5%. And then something that we learned very early on with user testing, we always were working directly with patients, working with patient communities, co-designing, was like one of the biggest things that impact people is the financial burden. Like, it's very hard to take care of yourself when the financial elements are such a burden on you. So things around finances and like, that's really interesting for me, and what we can do with that beyond the clinical data. That's what makes me excited, is moving into the financial space for healthcare and helping people navigate the system.
Yeah.
Yeah, and from our perspective, it's really about people being able to see things and take action on it, right? We're very excited when we're presenting something that is, something that's clean for them to use and to be able to do something that is actually going to improve their care. I know from when we started off, we had a lot of high expectations that the real value that we were adding was on that advocate side. How do you help people who are caregivers of individuals that don't have any insight into what their care management looks like? And how do we improve that? So from that side of it, I think we really were trying to focus, and I think we're continuing to try and focus on how can we smooth that out, and make that sharing process a little bit easier. It sounds like Jennifer's got some great ways of possibly adding in some value on that there. So I would be curious to kind of look at that a little bit more as well in terms of how we might be able to integrate stuff like that going forward.
Yeah, great. Well, thank you. Jennifer, when we lost you for a few minutes, we talked a little bit about privacy and security, so you dropped off at the right time. I commented how a couple health plans who we had on earlier today had all talked about privacy and security and the changes and the adaptations that had to happen within their own teams, right, to get comfortable with this way of doing business. And I'll just say that we have a lot of health plan organizations who are on the conference, who are listening, and it's really impressive, very validating. hopefully for them all to hear 2 examples of organizations that are doing good with all of this data and have the, really out there to create products that the patients and their families can use to better, their own lives, and all that is sort of their healthcare. So thank you guys for sharing your stories. Thanks for sharing your perspective on the industry. Thanks for making some time for us today. And we certainly look forward to what's to come with both of your products.
Thank you.
Yes, thank you.
Okay, great. Take care.